First aid fundamentals. The distance between crisis and safety often narrows to minutes, sometimes seconds. Across this critical gap, knowledge of fundamental first aid techniques frequently determines whether an emergency becomes a manageable incident or spirals into tragedy. In our modern world, we've grown accustomed to immediate access to sophisticated medical care. Ambulances arriving within minutes, emergency rooms staffed around the clock, and specialists available for consultation at a moment's notice. This remarkable system typically functions seamlessly in everyday life, creating an invisible safety net we seldom acknowledge until personal emergency forces its recognition. Yet, this dependence harbors a profound vulnerability that becomes starkly apparent during widespread emergencies, natural disasters, or situations where professional medical resources become overwhelmed or entirely unavailable. The consequences of this knowledge gap extend beyond theoretical concern into sobering statistical reality. Studies consistently demonstrate that immediate, appropriate first aid intervention significantly improves outcomes across numerous emergency scenarios, from cardiac events where every minute without appropriate action decreases survival chances by 7 to 10%, to severe bleeding incidents where proper pressure application can prevent fatal blood loss within the typical ambulance response window. These critical minutes cannot be recovered once lost, regardless of the sophistication of subsequent professional care. The intervention window remains unforgivingly brief, demanding immediate, appropriate action that only comes through preparation, not improvisation during crisis. This knowledge gap affects diverse populations across varying circumstances. In rural communities, professional medical response may naturally require extended time frames due to geographical constraints, creating inherent delays even under ideal conditions. Urban residents face different challenges during mass casualty events or natural disasters, when normally abundant medical resources become suddenly inadequate for overwhelming demand. Even in routine emergencies, the critical initial minutes before professional arrival remain the responsibility of bystanders whose actions or inaction shape outcomes before uniformed responders ever arrive on scene. Beyond strictly medical implications, psychological resilience strengthens considerably when individuals possess concrete skills applicable during emergencies. The profound helplessness experienced when confronting medical crises without appropriate knowledge creates lasting psychological impacts, regardless of ultimate outcomes. Conversely, the confidence that comes from competent emergency response provides psychological protection not only for those providing assistance, but also for those receiving care, who benefit from the reassurance that comes from witnessing confident, appropriate action during their most vulnerable moments. Perhaps most concerning, essential first aid knowledge has receded from common experience despite its enduring importance. Previous generations routinely possessed basic emergency response skills as part of everyday life, particularly in environments where professional medical care remained distant or limited. This cultural knowledge transmission has largely disappeared, placed by specialized professional services that, while extraordinarily effective when available, create dependency rather than distributed capability. The resulting knowledge vacuum leaves many individuals fundamentally unprepared to address even straightforward emergencies, despite having access to more medical information than any previous generation through digital resources. Fortunately, rebuilding this essential capability requires neither extraordinary aptitude nor extensive medical background. The most crucial first aid skills remain accessible to anyone with basic physical abilities and willingness to learn systematic approaches to common emergencies. Preparing for medical emergencies. Effective first aid begins long before emergencies occur. Systematic preparation, both mental and materials, the foundation for successful intervention when crises emerge. This preparation extends beyond merely assembling supplies into developing appropriate mindsets, establishing response frameworks, and creating environmental conditions conducive to effective emergency management. Without this foundational preparation, even individuals with theoretical knowledge often struggle to implement effective care during actual emergencies due to pressure-induced performance deterioration, resource limitations, or environmental constraints that might have been mitigated through advanced consideration. Mental preparation requires developing both psychological resilience and systematic thinking patterns applicable during high-stress situations. Cultivate emergency response mindsets through realistic scenario consideration, not merely reading about emergency procedures, but mentally rehearsing complete response sequences while visualizing potential complications and adaptations. This mental practice develops neural pathways that remain accessible during actual emergencies, despite stress-induced cognitive narrowing that typically occurs during crises. Many experienced emergency responders report that this mental rehearsal proves more valuable than physical practice alone, as it develops decision-making capabilities rather than mere procedural familiarity. First aid supplies require thoughtful assembly based on likely emergency scenarios. Specific environmental challenges, and practical carrying considerations rather than generic checklists. Basic kits should include bleeding control materials, various bandages, gauze, pressure dressings, wound cleaning supplies, antiseptic solutions, irrigation devices, immobilization materials, various splints or adaptable materials, basic medications, pain relievers, antihistamines, personal prescription medications, and appropriate personal protective equipment, including gloves and face shields for CPR. Beyond these fundamentals, customize kits based on specific activity risks, geographical challenges, existing medical conditions among anticipated patients, and realistic evacuation timeframes that might necessitate extended care provisions. For comprehensive preparation, establish multiple integrated medical response layers rather than relying on single solution approaches. Consider developing distinct supply categories, immediately accessible personal kits carried continuously, activity, specific kits available during particular undertakings, household kits supporting family-level emergencies, and community-level resources for larger-scale incidents. Each layer requires different optimization priorities. Personal kits emphasizing portability and highest priority interventions, while household supplies can incorporate broader treatment capabilities and larger supply quantities for extended care scenarios. This layered approach provides appropriate resources across varying emergency scales without requiring overwhelming individual carrying capacity for all contingencies. Documentation systems provide crucial medical information during emergencies when stress affects recall or when responders lack familiarity with patient medical histories. Develop standardized documentation approaches including medical history summaries for household members highlighting critical conditions, medications, allergies, and treatment preferences. Medication lists with dosages, schedules, and prescribing provider contact information, and emergency contact information, including primary care providers, specialists, and family decision makers. Store this information in multiple formats, both digital and physical copies with appropriate privacy protection while ensuring accessibility during genuine emergencies. Consider established systems like medical alert bracelets for individuals with life-threatening conditions requiring immediate recognition by responders. Training requirements extend beyond mere information absorption into skill development through practice application. While written materials provide valuable reference, practical skills require physical implementation under progressively challenging conditions to develop genuine competency. Seek formal training through established organizations like the American Red Cross, American Heart Association, or wilderness medicine programs appropriate to your specific needs and likely emergency contexts. Supplement formal training with regular skill practice, both scheduled refreshers and opportunistic mental drills, while observing everyday environments. This combined approach develops both technical skills and environmental awareness that supports effective emergency response through habitual assessment patterns. Environmental preparation significantly impacts response effectiveness during actual emergencies. Conduct systematic home assessments, identifying both general hazards and specific emergency response challenges. Limited access points, poor lighting areas, evacuation obstacles, or communication difficulties. Address identified issues through strategic modifications like emergency lighting systems, improve storage arrangements for critical supplies, or furniture configurations supporting emergency treatment needs. For those with specific medical concerns, consider more significant environmental adaptations like shower grab bars, bedroom arrangements facilitating emergency access, or strategically placed emergency response equipment near highest probability incident locations. Communication planning provides crucial infrastructure during medical emergencies when coordination becomes essential but often deteriorates under stress. Establish clear emergency communication protocols within households, including rally points for various emergency types, notification systems for communicating emergency status to absent members, responsibility assignments for specific emergency functions, and decision-making hierarchies when normal family structures might be disrupted. Extend communication planning beyond household boundaries by establishing emergency contacts in various geographical areas, documenting local emergency resource contact information, and creating notification systems for extended family awareness during significant medical events. Special population considerations require additional preparation layers addressing specific vulnerabilities or requirements. For households, including elderly members, children, individuals with disabilities, or those with chronic medical conditions, standard emergency preparations often require significant adaptation and enhancement. These special considerations might include additional medication supplies with appropriate rotation systems, specialized equipment with backup power sources, alternative evacuation methods addressing mobility limitations, or simplified emergency instructions for those with cognitive challenges. These population-specific adaptations transform generic emergency preparation into genuinely functional systems supporting actual household composition and needs rather than theoretical emergency responses. Psychological preparation deserves equal consideration alongside physical readiness, particularly for medical emergencies involving household members or close associates. Develop appropriate emotional boundaries, supporting effective care delivery without debilitating distress when treating familiar individuals. Practice self-regulation techniques like tactical breathing, cognitive reframing, and procedural focus that maintain functional capability despite natural emotional responses to loved ones suffering. This psychological preparation extends beyond emergency moments into recovery phases, with realistic expectations setting about potential treatment outcomes, anticipated recovery trajectories, and appropriate professional support resources when emergency situations exceed personal management capabilities. Regular preparation maintenance transforms static plans into living systems adaptable to changing circumstances. Establish systematic review schedules for first aid supplies, checking expiration dates, replacing used items, updating based on changing needs, documentation updates, medication changes, condition developments, contact information accuracy, and skill refreshment, formal recertification, practice sessions, knowledge updates reflecting changing guidelines. This maintenance process creates opportunities to incorporate new household members into emergency response systems, adapt to developing medical conditions, and integrate emerging first aid practices as research refines optimal intervention approaches. Without this regular maintenance, initial preparations gradually deteriorate into outdated, potentially ineffective systems precisely when emergency needs emerge. Assessment and decision-making frameworks. Proper assessment provides the essential foundation for all effective emergency medical intervention. Without systematic evaluation, even technically perfect interventions may address secondary issues while life-threatening conditions progress unrecognized. Consistent assessment frameworks provide structure during high-stress situations when cognitive capabilities naturally deteriorate under pressure, emotional responses, and environmental distractions. These frameworks function not as rigid protocols, but as adaptable evaluation structures guiding attention toward highest priority concerns while preventing crucial oversight during chaotic emergency conditions. The primary assessment focuses exclusively on immediately life-threatening conditions requiring intervention within minutes or even seconds. This rapid evaluation follows the established ABCDE framework, addressing the most time-sensitive physiological needs in priority sequence. Airway patency, ensuring oxygen pathway clearance. Breathing adequacy, confirming actual air movement. Circulation assessment, verifying blood movement through pulse presence and bleeding control. Disability evaluation through basic neurological status. And exposure consideration through appropriate clothing removal for complete assessment while preventing heat loss. This systematic approach prevents distraction by obvious but less critical injuries, while methodically identifying and addressing the most immediately dangerous conditions before proceeding to less time-sensitive concerns. Airway assessment begins with simple observation listening for abnormal breathing, sounds like stridor, harsh sounds during inhalation, or gurgling suggesting partial obstruction. Looking for chest movement indicating air passage, and watching for signs of distress like tripod positioning, where patients lean forward, supporting themselves with extended arms in respiratory distress. For unresponsive patients, airway patency requires direct verification through appropriate techniques like head tilt, chin lift, or jaw thrust maneuvers, depending on injury considerations. This assessment must occur immediately upon patient contact, as inadequate airway function causes brain damage within 4 to 6 minutes, despite preservation of other physiological systems. Breathing assessment moves beyond mere airway patency to evaluate actual respiratory effectiveness. Look for appropriate chest rise during inhalation. Listen for breath sounds at both mouth and chest, and feel for exhaled air, confirming successful gas exchange. Normal adult respiratory rates range between 12 to 20 breaths per minute, with rates outside this range, especially elevated rates exceeding 24 breaths per minute, suggesting developing respiratory distress requiring immediate attention. Regular preparation maintenance transforms static plans into living systems adaptable to changing circumstances. Establish systematic review schedules for first aid supplies, checking expiration dates, replacing used items, updating based on changing needs, documentation updates, medication changes, condition developments, contact information accuracy, and skill refreshment, formal recertification, practice sessions, knowledge updates reflecting changing guidelines. This maintenance process creates opportunities to incorporate new household members into emergency response systems, adapt to developing medical conditions, and integrate emerging first aid practices as research refines optimal intervention approaches. Without this regular maintenance, initial preparations gradually deteriorate into outdated potentially ineffective systems precisely when emergency needs emerge. Assessment and decision-making frameworks. Proper assessment provides the essential foundation for all effective emergency medical intervention. Without systematic evaluation, even technically perfect interventions may address secondary issues while life-threatening conditions progress unrecognized. Consistent assessment frameworks provide structure during high-stress situations when cognitive capabilities naturally deteriorate under pressure, emotional responses, and environmental distractions. These frameworks function not as rigid protocols, but as adaptable evaluation structures, guiding attention toward highest priority concerns while preventing crucial oversight during chaotic emergency conditions. The primary assessment focuses exclusively on immediately life-threatening conditions requiring intervention within minutes or even seconds. This rapid evaluation follows the established ABCDE framework, addressing the most time-sensitive physiological needs in priority sequence. Airway patency, ensuring oxygen pathway clearance. Breathing adequacy, confirming actual air movement. Circulation assessment, verifying blood movement through pulse presence and bleeding control. Disability evaluation through basic neurological status. And exposure consideration through appropriate clothing removal for complete assessment while preventing heat loss. This systematic approach prevents distraction by obvious but less critical injuries while methodically identifying and addressing the most immediately dangerous conditions before proceeding to less time-sensitive concerns. Airway assessment begins with simple observation, listening for abnormal breathing sounds like stridor, harsh sounds during inhalation, or gurgling suggesting partial obstruction. Looking for chest movement, indicating air passage, and watching for signs of distress like tripod positioning, where patients lean forward, supporting themselves with extended arms in respiratory distress. For unresponsive patients, airway patency requires direct verification through appropriate techniques like head tilt, chin lift, or jaw thrust maneuvers, depending on injury considerations. This assessment must occur immediately upon patient contact, as inadequate airway function causes brain damage within 4 to 6 minutes, despite preservation of other physiological systems. Breathing assessment moves beyond mere airway patency to evaluate actual respiratory effectiveness. Look for appropriate chest rise during inhalation. Listen for breath sounds at both mouth and chest, and feel for exhaled air, confirming successful gas exchange. Normal adult respiratory rates range between 12 to 20 breaths per minute, with rates outside this range, especially elevated rates exceeding 24 breaths per minute, suggesting developing respiratory distress requiring immediate attention. Choking, commonly involving food or foreign objects, obstructs the airway and requires the Heimlich maneuver or back blows depending on patient age and consciousness level. Immediate action remains crucial as complete airway obstruction causes irreversible brain damage within minutes. Severe bleeding requires immediate pressure application, ideally using clean dressings or hemostatic agents. For extremity bleeding resistant to direct pressure, tourniquet application can control hemorrhage, but requires careful monitoring for ischemic complications when used for prolonged durations. Anaphylaxis, a severe allergic reaction, demands prompt administration of epinephrine via auto-injectors when available. Identifying early sign shives, swelling, difficulty breathing, gastrointestinal symptom senables, earlier intervention before airway compromise or circulatory collapse. Asthma exacerbations, characterized by wheezing, dyspnea, and chest tightness, respond best to bronchodilator administration using metered-dose inhalers, MDIs, or nebulizers. Encourage calm, controlled breathing during episodes, reducing hyperventilation-induced fatigue. Diabetic emergencies require distinguishing between hypoglycemia, low blood sugar, and hyperglycemia, high blood sugar, as treatment approaches differ. Hypoglycemia, characterized by shakiness, confusion, sweating, and potential unconsciousness, requires rapid carbohydrate administration, oral glucose gel, juice, candy. Hyperglycemia symptoms include excessive thirst, frequent urination, nausea, and altered mental status, often requiring professional intervention rather than field treatment. Seizures, typically involving convulsive movements or altered consciousness, require protecting the patient from injury without forcibly restraining movements. After the seizure ends, position the patient on their side to maintain airway patency and monitor for breathing regularity. Stroke identification using the fast mnemonic facial drooping, arm weakness, speech difficulty. Time to call emergency service enables faster professional intervention during the critical early period when thrombolytic therapy remains viable. Heat-related emergencies, ranging from heat exhaustion, sweating, dizziness, nausea, to heat stroke, hot, dry skin, confusion, loss of consciousness, require cooling measures including hydration, shade, and cool compresses. Rapid core temperature reduction remains essential during heat stroke to prevent irreversible organ damage. Cold-related emergencies, including hypothermia and frostbite, require gradual rewarming and protection from further heat loss. Hypothermia symptoms: shivering, confusion, sluggish movements worsen as core temperature drops. Use insulated layers, warm fluids if conscious, and body-to-body contact when practical. Frostbite, characterized by pale, numb, and hard tissue, demands gradual warming without rubbing the affected area to prevent tissue damage. Once rewarmed, avoid refreezing, which causes significantly worse tissue destruction. Shock resulting from various causes: blood loss, severe allergic reactions, dehydration, heart failure, manifests through pale, clammy skin, rapid pulse, shallow breathing, and weakness. Elevating the legs, maintaining warmth, and controlling bleeding if present. Support circulation while awaiting professional intervention. Burns require categorization based on severity: superficial, red, painful, partial thickness, blistered, and full thickness, charred or white, painless due to nerve damage. Cool running water alleviates pain for minor burns, while extensive burns require professional care. Never apply ice directly, as it worsens tissue injury. Poisoning, whether via ingestion, inhalation, or absorption, requires immediate contact with poison control for guidance. If conscious, prevent vomiting unless explicitly instructed. Identify the substance involved to inform professional responders, as treatments vary significantly between poisons. Fractures and dislocations necessitate immobilization to prevent further injury. Use splints padded with soft materials and avoid realigning bones unless compromised circulation threatens tissue viability. Monitor for signs of vascular compromise like cold extremities or absent pulses. Soft tissue injuries, including sprains, strains, and contusions, benefit from rice treatment rest, ice, compression, and elevation. Immobilization supports healing and reduces further tissue damage. Bites and stings, whether from animals, insects, or venomous creatures, require wound cleaning, tetanus prophylaxis, and monitoring for systemic reactions. Snake bites require immobilization and professional evaluation without aggressive field interventions like cutting or suctioning. Preventative measures, including protective equipment use, environmental awareness, and activity planning, significantly reduce the likelihood of encountering these common emergencies. training household members in basic first aid and encouraging continual practice reinforces individual and community resilience. Maintaining calm under pressure enhances effective intervention during emergencies. Stress management techniques practiced regularly improve performance consistency when facing real crises. Confidence born from preparation transforms bystanders into valuable first responders when medical systems falter or delay. Continual learning and skill reinforcement remain essential components of emergency preparedness. Reviewing case studies, attending refresher courses, and participating in practical scenarios maintain both knowledge and readiness for real-world challenges. While no preparation guarantees absolute safety, disciplined training, practical skill development, and thoughtful planning reduce vulnerabilities during critical moments when every second counts. By embracing a proactive mindset and developing essential first aid capabilities, individuals transform from passive recipients of care into active participants in their own safety and the well-being of their communities. The role of psychological preparedness in first aid cannot be overstated. Situational awareness and composure directly influence decision-making and the quality of care provided. Those who cultivate emotional readiness are better positioned to support both themselves and those around them during emergencies. Understanding one's own reactions to stress helps in moderating panic responses, allowing for clearer thought processes. Simple techniques like controlled breathing, grounding exercises, and mental affirmations can quickly reduce anxiety, helping maintain composure when immediate action is required. Developing a culture of preparedness within families or communities enhances collective resilience. By openly discussing potential emergencies, practicing response strategies, and assigning roles based on strengths, groups build a shared foundation for dealing with crises together. Practicing communication strategies, such as clearly stating the nature of an emergency when calling for help, avoids confusion and ensures that responders receive accurate information. Practicing clear, concise reporting, like providing location details and injury descriptions, significantly impact the speed and accuracy of assistance. Preparedness also extends to ensuring that everyone knows how to operate emergency equipment. Practice using fire extinguishers, first aid kits, and AEDs to build familiarity. Simple hands-on drills reduce hesitation when equipment is actually needed. Finally, maintaining a practical perspective on preparedness prevents burnout. While vigilance is valuable, balanced preparation allows individuals to remain grounded without becoming overwhelmed, building adaptable skills rather than fixating on worst-case scenarios creates a healthy mindset that supports everyday well-being while still being ready for emergencies. A fundamental aspect of preparedness is recognizing the limitations of one's skills and resources. Knowing when to escalate to professional care is as important as performing initial interventions. Situations that exceed basic first aid capabilities like severe trauma, unresponsive patients, or rapidly deteriorating conditions require prompt activation of emergency medical services. Being honest about your own abilities avoids potentially harmful improvisation. Instead, focus on stabilizing the situation and maintaining patient comfort while waiting for advanced care. In scenarios where professional help is unavailable or delayed, prioritizing the most life-threatening issues remains key. Addressing airway, breathing, and circulation should precede attempts at treating less critical injuries. This disciplined approach conserves both energy and resources during prolonged emergencies. Situational awareness continues to play a vital role throughout the emergency response. Monitoring environmental changes like shifting weather, potential hazards, or crowd dynamics helps anticipate new risks and adjust strategies accordingly. Emergency planning should incorporate contingency scenarios, recognizing that initial plans may need modification when unexpected variables arise. Flexibility and problem-solving capabilities enhance the ability to adapt, maintaining safety and continuity of care. Training should include realistic scenarios that mimic potential emergencies specific to your environment, whether that means urban accidents, rural medical delays, or wilderness challenges. By practicing under controlled stress, skills become more reflexive, reducing hesitation when genuine emergencies occur. In community settings, establishing emergency response networks distributes the responsibility of preparedness. Forming groups with diverse skills like first aid, fire safety, or logistical coordination enables a more comprehensive approach to crisis management. This cooperative planning fosters mutual support and resource sharing during critical incidents. Sharing knowledge within your network strengthens the overall response capability. Teaching friends, family, or neighbors basic first aid skills and emergency procedures empowers more people to act confidently. Collective competence reduces dependence on a single responder, making the group as a whole more resilient. When organizing resources, emphasize accessibility. Critical items like medical kits, communication devices, and personal identification should be stored in easily reachable locations. In situations requiring rapid evacuation, having pre-packed emergency bags ensures essential supplies are available without time-consuming searches. The value of drills and practice exercises becomes evident when theory is put into practical application. Performing simulated responses in familiar environments builds both muscle memory and spatial awareness, making real responses more fluid and effective. Emergency communication devices deserve special consideration. While smartphones are common, they may become unreliable during widespread disruptions. Investing in alternative communication methods like two-way radios or satellite phones provides redundancy when conventional systems fail. Considering psychological impacts, especially during prolonged emergencies, promotes both individual and group morale. Maintaining routines, preserving social connections, and fostering a sense of purpose can mitigate the mental strain of uncertain situations. Leading by example, staying calm, and demonstrating positive problem-solving attitudes influence others to remain resilient. Lastly, consistent reflection on past experiences and learning from both successes and failures sharpens preparedness strategies. Whether reflecting individually or discussing within a group, analyzing what went well and what could improve informs future responses. This ongoing cycle of practice, reflection, and adaptation forms the cornerstone of comprehensive preparedness. Preparedness is not just a set of skills or a stockpile of supplies. It's a mindset cultivated through continuous effort and commitment. Developing a preparedness culture within households and communities fosters a proactive attitude toward potential challenges. Encouraging open conversations about readiness helps normalize preparation without creating fear or paranoia. By approaching the topic as a practical life skill rather than an apocalyptic necessity, people are more willing to participate actively in building their own resilience. Emergency response planning should always include realistic self-assessment, acknowledging physical limitations, health conditions, or lack of experience allows for more tailored approaches. Adapt strategies to fit personal capabilities rather than forcing adherence to rigid standards that may not be practical. Including diverse perspectives during planning sessions uncovers potential blind spots. For instance, considering how children, elderly individuals, or those with disabilities might experience emergencies highlights areas requiring additional resources or modified procedure. Documentation remains a crucial aspect of preparedness. Maintaining accurate medical records, including immunization history and known allergies, facilitates faster and more effective care. Digital backups, as well as physical copies in waterproof containers, offer redundancy. Evaluating local risks guides more focused preparation. Whether prone to natural disasters, industrial accidents, or social disruptions, understanding specific threats informs both preventive measures and response strategies. Customizing emergency kits and communication plans based on these local factors enhances relevance and practicality. Training should remain an ongoing commitment. Regular refreshers keep skills sharp, while new information and techniques can be integrated as they become available. Building familiarity with various scenarios reduces anxiety when situations deviate from textbook expectations. One of the most powerful elements of effective preparedness is community engagement. Collaborative planning increases resource availability and distributes the workload. Forming local response groups, holding training sessions, and conducting joint exercises strengthen collective readiness. Educational outreach also plays a vital role. Sharing basic first aid techniques through workshops, community events, or online platforms encourages broader participation. Providing accessible, jargon-free resources ensures that more people feel confident in their ability to contribute during emergencies. Respecting individual comfort levels remains essential when promoting preparedness. Some may feel overwhelmed by detailed planning, preferring incremental steps rather than comprehensive strategies. Meeting people where they are fosters gradual buy-in without alienating those who may initially feel resistant. Finally, maintaining flexibility within preparedness plans acknowledges that no scenario will unfold exactly as predicted. Building adaptable skills like problem solving, improvisation, and resourcefulness allows individuals to adjust as conditions change. Taking a holistic approach to readiness, incorporating physical, mental, and social components, creates a balanced foundation. This perspective shifts the focus from merely surviving emergencies to thriving through them, confident in one's ability to navigate uncertainty. As communities face increasingly complex challenges, preparedness shifts from an individual pursuit to a shared responsibility. By fostering a culture of awareness, mutual support, and continuous learning, people become better equipped not only to respond effectively, but to recover more resiliently. One of the lasting lessons from real-world emergencies is the value of preparation over mere reaction. When individuals take the initiative to build their skills, gather resources, and foster a mindset of readiness, they transform from passive bystanders into active participants in their own safety and the safety of others. This transformation does not happen overnight. It requires consistent practice, periodic reflection, and the willingness to update approaches as new information emerges. However, the investment in preparedness pays dividends during critical moments when well-practiced actions replace hesitation and confusion. In today's interconnected world, the ability to respond effectively during emergencies also serves as an invaluable form of community service. Those who prepare are not only better positioned to care for their own families, but also to assist neighbors, co-workers, or strangers who may find themselves overwhelmed. While some may view preparedness as a burdensome responsibility, the reality is that the confidence it brings significantly outweighs the effort involved. Peace of mind comes not from hoping that crises will never occur, but from knowing that you are equipped to handle them if they do. In the end, the goal of preparedness is not to eliminate risk entirely, a task that remains impossible, but to manage that risk with skill, clarity, and determination. Emergencies will always present challenges, but through preparation, individuals can reduce their impact, protect lives, and build resilience. Reflecting on the journey from vulnerability to capability, it becomes clear that the most crucial resource is not a tool or a kit, but a mindset dedicated to continuous learning and practical application. By integrating preparedness into daily life, people ensure that when emergencies do arise, they are not merely surviving, but taking proactive steps toward recovery and stability. Whether faced with natural disasters, medical emergencies, or unforeseen crises, those who prepare are better positioned to protect themselves and those they care about. Through practice, reflection, and community involvement, preparedness becomes not just a plan, but a way of life. In the words of an old adage, fortune favors the prepared. In the context of emergency response, fortune is not about luck, but about readiness, practice, and the confidence that comes from knowing how to act when every moment counts. By fostering a culture of preparedness within families, workplaces, and communities, people become empowered to face adversity with strength and resilience. In doing so, they transform emergencies from chaotic, unpredictable events into challenges they are equipped to overcome. Ultimately, preparedness is not about predicting the future, but about building the capacity to respond effectively regardless of what the future holds. In this way, preparation is not just a practical endeavor, but a philosophical commitment to taking responsibility for one's own safety and the well-being of those around them. When preparedness becomes a mindset rather than a checklist, it integrates seamlessly into daily routines, enhancing awareness without inducing anxiety. This balanced approach ensures that readiness becomes part of everyday life, contributing not only to safety, but also to a sense of purpose and agency. As you continue to build your skills, gather knowledge, and encourage others to do the same, remember that every small step toward preparedness strengthens both individual and collective resilience. By choosing to be prepared, you are choosing to face challenges with courage, competence, and the unwavering belief that through thoughtful action, crises can be managed and overcome.